Now, as a big Star Wars fan, you and I know that the rule of two is all about how there's one master and one apprentice and no more. But actually there is another rule of two, and given that I'm a dentist and we should really be talking about dentistry, let me tell you about the rule of two when talking to patients about options. So sometimes when patients have a clinical problem, it's very easy to make our conversation technical and full of superfluous information. And although we really do need to get to know our patients and deliver to them what dentistry can offer, I find that if we can do that in a really simplistic way, then it allows patients to come on board with us more and allow them to pick options that I feel really benefit them and really help them the most. After all, I think very few patients will pick their options based on cost alone. Often there's far more to do with the suitability of a certain treatment modality. And I want to find patients the best treatment because I want them to look back 5 years later and say, you know, he was a good guy. He spoke to me about what was available and he helped me to pick the best one for me. He was a good guy and I'll recommend him to others, rather than them looking back and regretting the time that we had together and the treatment that I did for them, even though I would have tried my best to do it. So let me talk to you about what the rule of two has helped me to do. And first of all, if I may, let me do a little shout out to an Australian dentist called Mark Hassad, who is the first person who spoke to me about the rule of two. So thank you, Mark, because your help has helped me to help my patients. So the ripples of goodness have gone out in the world. My practice is now limited to implant dentistry. So a conversation I have with patients very commonly is about missing teeth and the options that are available for them to restore spaces. Once upon a time, as a younger dentist, I would often speak about all the options that were available and give them a little bit about each. So for example, I might say, right, you've got a gap there and what we can do is to do nothing. Or we could provide you with removable teeth like a denture, and you could have either a metal one or a plastic one. You have to take them out at night and put them back in the day, and they can be a little bit wobbly but not too bad, and I think you'll be okay. They should look quite nice. Or you can have a bridge, and with the bridge what we have to do is a fixed tooth, but we get to shave the teeth either side so that we can fix something in really well, and it's a firm restoration, but we have a little bit of damage to the other teeth. Or there's an implant. Implant is a fixed solution in which we put a post into the bone and then we're able to put a tooth onto that post so it doesn't damage any of the other teeth, and it should look pretty good and it should function really well, and it should be firm and you can chew and bite. They take a look at me and they say, yeah, you know, I think I really like the sound of the bridge. I think having removable teeth would suit me really well. Hang on a second. Does that mean you've listened to nothing that I've said? And I would get really frustrated thinking, I'm trying my best to simplify the way that I'm communicating these options, but there were just too many of them. So it made things really difficult for a patient who, let's face it, knows nothing about dentistry. And why should they? There is a big difference between stupidity and ignorance. I'm ignorant about a huge number of things. I like to think I'm not a stupid person though, but the first time I want to hear or learn about a new topic, if that can be conveyed to me in a really simple and straightforward way, it's going to make it easier for me to understand. And I think we owe it to our patients to do the same for them. So how does the rule of two work? Well, the rule of two works by trying to imagine a little decision tree in your own mind, so that all you're ever doing is giving the patient two options. And once you have made the decision on one way or the other, then you can go to the next branch of that tree and make the decision there. So, for example, I might say to a patient now, you have a gap. Would you like us to put a tooth in there, or would you like us to leave the space? Oh, I think I'd definitely like to have the tooth, please. Excellent. Right then. So, would you like to have a removable option, or would you like to have a fixed option? Removable? What, you mean dentures at my age? No way, Jose. Talk to me about the fixed ones. Okay, let's discard the removable and we will now focus on fixed. So, if we're doing fixed teeth, we can either do a bridge or we can do an implant. And then I can start to talk to them about the merits and benefits of those two. But what we've done there is we have discarded options that simply don't suit our patients at all. Why bother talking about acrylic and chrome if there is no way we will please our patient by providing them with a removable option? So this is how I use the rule of 2 for spaces, but we can use the rule of 2 to communicate whichever kind of options that we have when helping to navigate our patients through this maze of dentistry. And I find that if you can be a really good guide for your patient, simplify things and help them to make good decisions for them, then you will have a patient who will sing your praises and a reputation that will grow massively. If you enjoyed our video today, then please join me again for more, and don't forget to like, subscribe and share. I'll see you next time.